tonight's meeting again has been funded by UIF, the University's Innovation Fund. As I said, it's the second in a series which is focusing on cattle health, improving cattle health, titled Health is Wealth, and what is the potential for improved cattle health within your herd. And that's really the key thing to be thinking about throughout tonight and the presentations again, is what is the potential gain for your herd if cattle health is improved. As we discussed last week, a healthy herd is a profitable one. And last week we focused on health planning and sort of disease management and a focus on really that disease and ill health affect herd performance. This week we'll have a greater focus on disease and risk management. We've got a fantastic lineup of speakers once again. John Schofield from SRUC Vet Services is with us tonight to talk us through cattle health schemes and give us an overview of what being in a health scheme means for you and your herd. Leslie Wiley, SAC Consulting Beef Specialist, has got a presentation for us on health status of breeding cattle at sales and given a good sort of overview and things to look for. Key things to be aware of when buying in breeding cattle, be it bulls or heifers. And we're also joined again tonight by Helen Carty from SRUC Veterinary Services. Helen has stepped into the breach last minute as unfortunately Tim Geraghty couldn't make it tonight. Helen will focus on Johne's disease tonight and give us an overview on how this disease is affecting suckler herds and just to raise awareness of the disease within your herd. We also have Malcolm McDonald working in the background. He's here to assist us with any issues. So if you have any problems with hearing us speakers, viewing the slides, or for any reason you need to leave or rejoin the meeting, Malcolm will be there to assist. Please use the chat box to ask questions. During the presentations, we will have a quick sort of 5-minute session after each speaker for questions as they come in, but we'll also have plenty of time at the end for questions. But please feel free to use these chat functions to ask your questions. And without further ado, I'll hand you over to our first speaker for tonight, John. Over to you, John.
Thanks very much, Sarah. Just give me a minute to share my screen. So hopefully you can see that now.
Yep, and that is in presentation mode.
Okay, great. Okay, so yeah, my name's John Schofield. I work in the marketing for SRUC Veterinary Services, a lot of which covers the health schemes that we run, both the Premium Cattle Health Scheme, which PCHS for short, as well as the Sheep and Goat Health schemes that we run. But it's the cattle health schemes I'll be focusing on tonight. Sorry, is it out of presentation mode again?
It's moved out. That's it back.
Yeah, that back. Yeah, great. Okay, so the PCHS covers a number of diseases listed down the side there. So BVD, Johne's disease, IBR, leptospirosis, Neospora, which make up the core of the scheme. And there's an optional add-on for TB. I'll sort of cover how the scheme works, as well as a bit more detail on each of those diseases. The scheme is governed by CHECS, which is the Cattle Health Certification Standards. So they are the governing body for cattle health schemes in the UK. So they, set the rules, etc. for the schemes, and we provide the lab testing and managing of the members. But our vets also do have input into CHECS in terms of developing the schemes and developing protocols, which sort of change over time as things progress. So the way it works is members pay an annual subscription to PCHS, which then gives them the choice to test for the different diseases. So for the 5 main diseases, so you can join and test for just BVD, or you can join and test for any, between 1 and 5 of the diseases, whichever you're wanting to focus on. And then there is the option to add on the TB for a little bit extra. So in terms of the reasons why somebody might want to join a health scheme, the schemes are nationally recognised, covering the whole of the UK. So we have members Scotland, England, Wales, and a small number in Ireland. So the main reason a lot of people want to join is to add value to their stock for potentially higher returns when selling, whether that's through auction or private sales. There's a lot of buyers out there that want to have some assurance that what they're buying is healthy and not going to introduce disease into their flock or herd. A lot for the pedigree world, a lot of breed societies actually stipulate that their members have some level of accreditation when they go to the society sales. So different sales will have different breed societies will have different rules. If you go to one of these sales, there's an option to have a pen card like the one shown below. So these are a great way of showing, these are normally displayed in the pens above the cattle, and it's a great way to show buyers what, the herd level of accreditation, as well as, individual results for schemes that people may not be engaging with, as well as vaccination statuses. So as well as the selling option, other reasons that people might want to join a scheme would be for if they've had a disease outbreak that they're wanting to get under control by doing, testing with the help of their vet and our labs to sort of manage that and follow the protocols to eradicate or get the disease as under control as possible. Another reason people join the scheme is if they've had to cull a herd because of a disease outbreak, they may wish to restock starting with entirely accredited stock, so that they know where they're starting from, and then starting with the accreditation from that point, so they can keep that status. And the schemes also sort of provide, a good framework and prompts for testing. So, for herds that might not want to be selling at breeding stock, it's still a good way of keeping on top of health and having some structure to it. So that the way that it works is that the vets, a farmer's vet practice would come out, take the samples required for the scheme and submit them to our lab. So, there is the interaction there with the vet that you already have a working relationship with. And then our vets at our labs can, discuss any potential steps needed with the farmer's vet practice to move things forward. Another reason that a lot of people, some maybe more commercial buyers might wish to be in the scheme is just for the discounted testing rates that the scheme offers. So once you've paid your membership, the cost per test is then cheaper than it would be if you weren't a member of the scheme. So I've just got a little breakdown here of the membership that we have. So at the moment, it's sitting at just over 3,600 members altogether. So there is sort of, since the schemes have started, there's been a continuous upward trend in terms of numbers. It's sort of gradually going up year by year. Some members are leaving because they're not selling breeding stock anymore, for example, or they're just not farming cattle at all anymore. And then just always getting new members joining. So and you can see the breakdown of where they are in the UK there. So just under half being in Scotland, and then quite a big chunk in England, a smaller amount in Wales, and a smaller amount in Ireland. On the table on the right there, I've just put the percentage that are accredited for each disease. So there would be other members. So for example, we would have other members besides that 42% are engaging with the BVD scheme, but they just haven't got accreditation yet. So either they're still going through the process of qualifying for accreditation, or they may have had a positive case and their accreditation is currently suspended and they're working to get it back. But yeah, that's just an idea of how many we have. In terms, I'll come on to this in a minute, but the Ionis and the Neospora schemes are actually risk level based. So rather than being accredited or not accredited, it's a case of risk level 1 through to risk level 5. So for the purposes of the Ionis disease percentage there, I've just included herds that are in the top 3 risk levels, and the Neospora scheme more recently moved to the risk levels. So there's still a number that are trying to work up to the top risk level. So that 5% there just includes all of our membership that are currently engaging with the Neospora scheme in some way. The numbers there add up to more than 100%, because obviously some members will be testing for more than one of those diseases. So the first disease to discuss, which quite a big high proportion of our membership, is BVD. So yeah, as you can see by the stats on the side, it's estimated that about 90% of herds in the UK have had some sort of contact with BVD. So it's yeah, it's endemic in the UK. It's spread by PI calves, which are the calves that have been come into contact with the virus while in the womb. So they're then born and will continue to shed the disease, shed the virus throughout their life, infecting you know, any other cattle they come into contact with. If they come into contact with a pregnant cow, then the calf that's born will be a PI, and that's how the disease continues to spread through a herd. Something worth remembering is that they don't always look ill or sickly. They can be healthy looking calves and still just be as big of a problem. So the 2 ways that we go about testing for BVD within PCHS are either by check tests, which are blood tests looking for antibodies, and that is 5 calves per management group that need to be tested per year between the ages of 9 and 18 months. So if they're all clear, no sign of antibodies, then within testing of 2 calf crops, you can gain BVD accreditation. If there were antibodies found, then you would have to do further testing to identify if there was a PI. And the other option for testing for BVD is the tissue tags. So they can just be done. Every calf that's born can have a tissue tag done, and they will identify PIs. And again, with once 2 calf crops are tested with those, assuming there's no PIs found, then BVD accreditation can be gained. So yeah, in terms of the actual effects of the disease, it affects the fertility, milk yields, daily live weight gains. It can have an effect on all of those sort of things. So it's reducing the productivity of your herd, and it also suppresses the immune system. So while it's sort of rare that BVD would be the cause of death, it can lead to them contracting other illnesses that would then cause more losses. So as well as the testing, for the scheme also has biosecurity rules, mainly to prevent nose-to-nose contact between animals. So on farm, that would be you know, sort of a 2-meter ring fencing to stop contact with any unaccredited animals. You know, if there's neighbours with cattle. There's also stipulations about when you're taking animals to shows or sales and transporting them. So any sharing of equipment with unaccredited animals could result in transmission, whether that's sharing transport or even things like people wearing overalls and moving between herds and working with the cattle. So there are also a number of national schemes which from the different UK governments, which the PCHS sort of interacts with in various ways. So BVD Free England, the Scottish government, BVD eradication scheme and the Welsh scheme, so some of which we do the testing for. So moving on to Johne's disease, I won't cover too much of the specifics of the disease itself because Helen's going to be talking about that. But the disease is caused by the MAP organism, which is related to TB, which is worth bearing in mind because it's important not to do your Johne's disease tests just after having the skin tests for TB, because it can cause false reactors. So this is sort of quite a hard disease to eradicate, which is why we go with the risk level scheme. Risk level 1 being the lowest risk and risk level 5 being the most risk, but we don't say that there's ever that the herd is accredited as being free from Johne's disease. It's just sort of the best possible scenario. So for this scheme, you have to test all animals over the age of 2 years old, and that's annually. And you wouldn't, even though they could contract the disease and be shedding it as calves or young animals, they wouldn't. They would be hard to identify on a blood test, which is why we test everything over 2 years of age. So it's blood tests as the initial test, and confirmatory fecal testing if there are high levels in the indicated in the blood test. So the blood test isn't a simple positive or negative. It's you know, sort of a level between 1 and 100. So and you know, for those that are sort of on the inconclusive side of things, those same animals tend to test higher and higher each year. So you know, we do recommend culling out based on the blood tests even before doing confirmatory fecal testing. It's important to remember that the Johne's disease also affects other ruminants such as sheep and goats, with some strains being able to pass between cattle and sheep. And the disease can be spread through, it can survive on pasture for up to a year and in slurry. And it can also be transmitted via watercourses. So if there's an infected farm upstream, you know, there have been cases of you know, herds downstream then picking up Johne's disease as well. So I'll move on. So yeah, IBR is another one in PCHS, with less people testing for it than BVD and Johne's disease. Yeah, it's very contagious disease. As with BVD, it's a case of trying to keep animals from coming into nose-to-nose contact with animals of an unknown health status. It can lead to severe pneumonia, which can be fatal. Again, it's you know, one that's endemic in the UK, with an estimated 40% of cattle having been exposed to the disease. Milder cases can result in conjunctivitis and poor milk yields. In more serious cases, you can start to see abortions. It's also important to remember that in terms of vaccinating, there is a marker vaccine available. So if you were in the health scheme and wanting to vaccinate, it's important to use the marker vaccine and to let our staff know that that's what they've been jabbed with, so that we can do the correct test to identify that. And it's important that if you're buying in cattle as well, you need to know their vaccination status and if marker vaccine has been used. Otherwise, the test would just show that they had antibodies for IBR. So for this one, it's a case of testing all animals over 12 months of age, and then testing them again between 1 and 12 months later. If there's then 2 clear tests, that's accreditation gained, and after that, it's just a case of testing annually. So another disease on there is leptospirosis. So again, another one with high percentages estimated that UK cattle have been exposed to. In terms of the clinical signs, there can be no clinical signs seen at all, or with some strains, you can see abortions dropping in milk yields, soft and flabby udders with colostrum-like secretions, and even sort of blood-tinged milk. But yeah, there can be no signs. It's spread via urine and infected water sources, and the reason it's quite an important disease is because it is transmissible to humans. Again, in terms of what our scheme requires, is that there's a test for all animals over 2 years old, as well as any breeding stock that are between 1 and 2 years old. So after the initial test, they would then be tested again between 6 and 12 months later. And then if both those tests were clear, accreditation would be gained. And after that, it would just be a case of testing a proportion of the herd annually. The fifth disease that we cover is Neospora, which is spread via dogs and dog feces. So it can be a case of dogs that are on the farm, or if you've got footpaths going through your land, with dog walkers, if there's feces there and the cattle ingest it, that can lead to infection. Another issue is feces that gets into the silage or the food sources. So with this one, when infection first comes into a herd, there can be abortion storms with large numbers of cattle aborting. Once the cattle have picked up the infection from dogs, it's then a case of it transmitting from mother to baby while it's in the womb. If they don't abort, that the baby can then be born and be infected with Neospora, and then in turn abort if they become pregnant. Again, this is a risk level scheme like Johne's disease with risk level 1 to 5. So risk level 1 would be those that, and this applies to Johne's disease as well, would be those herds that have been testing negative for at least 3 years. Risk level 2 would be those that have been testing negative but haven't quite reached the 3-year mark yet. Risk level 3 is those herds that have less than 3% positive cases, and risk level 4 and 5 are when you start to get higher numbers than that. So for Neospora, it's a case of testing all females over 2 years old, plus any female 1 to 2 year olds that are going to be kept for breeding, and any purchased animals. I haven't got a slide for the TB scheme that we run, but that is we don't do the tests ourselves. It's taking the DEFRA tests and awarding a status off the back of that, as well as biosecurity rules that need to be complied with. So once you've got your accreditation, it tells you how many years free your herd has been from TB. So it's quite good for trading if you live in a high risk area, and you want to show that your herd's been free of TB for however many years. So in terms of what all that means for buying and selling cattle, it's important to be aware that buying cattle does always carry some level of risk with it. But it's a case of understanding the risks and minimizing them where possible. It's important to know the status of purchased animals. So using resources like the pen cards if they're available, or asking a seller to see their certification if they're a member of a health scheme, as well as verifying it with our office if you need confirmation. It's important to, if you are a member of the scheme, it's important to isolate animals after they're purchased, even if accredited, and test them before mixing them with the rest of the herd. If they've been bought at at an auction, there's always the possibility that they've picked something up at the mart or in transport. So you don't want to bring them home and add them, and then all your accredited animals go down with whatever disease. It's also important that if your herd isn't accredited and you go out and buy a really expensive bull and it's accredited for everything, that you don't bring it home and mix it with the herd at home where there might be some underlying disease, because then the expensive bull you've bought is just going to go downhill pretty quickly. So it's important to know your own status of your own animals. It's also, if you're purchasing privately, it's worth trying to get the animal tested on the farm of origin, so you know what's happening before you bring it home. And it's also good to remember that if you take an animal to a sale and it doesn't sell and you bring it home, it might be worth isolating and testing it because it could have come into contact with something at the sale. So yeah, thanks very much. Hopefully that covers everything, and we can take questions if anybody's got any.
There we go. Thanks, John. A quick question. What are the costs involved with the health scheme? What does the membership cost?
Sure. So the basic membership, if you are doing the wanting to do the 5 diseases or up to the 5 diseases, is £78 annually. For the first year, that's normally charged at half price. If you want to add the TB accreditation, it takes the annual membership up to £109. Or the TB on its own is available at £40. After that, it's a case of paying per test, and that just really depends how many. Obviously, it depends how many cattle you've got and what proportion are being tested. But for just a few ones, BVD antibody £3.70, Johne's antibody £4.40. Leptospirosis £5.30. All the price lists are online, so we can send that link out with if anybody wants it, or you can find it on our website.
Thank you. Another one here.
Yep.
If you move from one health scheme provider to another one, does your herd health status move with you, or do you need to start the accreditation process again?
No, if it's another check scheme, then yeah, it can just move straight across. Yeah, the labs do sort of work together in those cases.
Okay, that looks like all the questions that we have at the moment, but as always, please feel free to use the chat box there if there is a question that comes to mind later on. As I said earlier, we will have another Q&A session at the very end for John as well as our other speakers. I'm just conscious of time, so I'll keep things moving, and I'll now hand over to Leslie Wiley, who's going to talk us through on breeding sales, purchasing breeding cattle, and things to look for associated with health, which is especially topical just now with bull sales and ahead of the spring breeding sales. Over to you, Leslie.
Yeah, so as Sarah said, I'm Leslie Wiley. I'm one of the beef specialists at SAC, and I work out of the Forfar office mainly. So basically, Sarah's asked me along tonight to talk about the health status of breeding cattle at sales and things to think about if you're needing to purchase breeding stock, so bulls, bulling heifers and calf cows, that kind of thing. So tonight I was just going to talk a bit about the importance of understanding your own herd health status before you start to bring in any stock. And then I'll talk a bit about the things to consider specifically when you're looking at buying a bull, and then again for some of the breeding females. And then I'll touch a bit on post-purchase, what to think about once you get them home. So when you look at your own herd health status, it's about understanding where your herd is in terms of what diseases are present and what risks there are to your herd. And I suppose working with your vet and having those discussions with your vet, either being part of a health scheme or actually just sitting down with your vet and discussing the risks that are unique to your farm will help you establish what's important in your herd. You've got to be mindful that the biggest risk to your herd's health is the introduction of new stock, but also if that new stock that you're introducing is naive or hasn't been exposed to some of the diseases present in your herd, you risk infecting that new stock coming into your herd. So it's important to look at it from both sides. And by having an understanding of what's going on in your own herd first, it kind of gives you an idea of what to look for or what to stay away from when you're purchasing new stock. Basically, John's covered quite a lot of what I was going to talk about here about all the different kind of diseases to look at. So basically the BVD one, it's just about understanding what's present in your own herd, and also what animals you're bringing in, whether they are immune or whether they've been vaccinated. And particularly with breeding females, the risk's quite high that of the potential to bring in a PI on pregnant animals. So that's something to be more aware of. And with the Johne's disease, again, you don't get Johne's free animals or Johne's free herds. As John said, they're low risk and then go up into higher risk levels. So it's about understanding what risk level your own herd is at, as to what you can happily accept in an incoming animal, and what would suit your risk level. But I'm sure Helen will talk more on that later on tonight. And yeah, John's covered quite a lot of these diseases. So yeah, basically about understanding in your herd what your BVD, if you've got BVD present, or whether you're testing or vaccinating, it's to understand how a new animal would fit into that regime, and knowing and being aware of the level of Johne's in your own herd, again, helps you decide what risk level you're willing to accept new animals coming in. So the really important thing is having a plan with your vet around about the introduction of new stock and how to minimize risks to both the new stock and your own herd, or your existing herd rather. So if you're going to buy a bull, as John said, you can get a pen card above a bull, which basically describes either the individual status of that animal or its herd that it's come from, the disease status of the herd it's come from. So it does give you quite a lot of information. In practice, there's not as many pen cards above bulls at bull sales as there used to be. I think there's a cost element now of getting a pen card from some of the health schemes. And also, when you enter a bull for sale, you can you fill in a herd health declaration, and it shows up in the catalogue index. So I've got a wee, on this slide, you can see what you get in an index, and it tells you that herd, for example, is TB4, BVD vaccinated, and the date it was vaccinated, BVD accredited, and Johne's risk level 1. So it gives you all that information in the catalogue. So sometimes a lot of the producers don't actually bother with the pen card because it's all in the catalogue. And this is really good because it means you can do a lot of your homework before the sale, and you're not at the sale trying to figure out what health status you're looking for. You can identify the animals that are fitting what you want in terms of health status and have them marked before you get to the sale. When you're at the sale, you can just look for the other criteria you're looking for in terms of EBVs or what the bull looks for, or different genetics. So it's a really good way of planning ahead and seeing what's available that meets your spec. So in terms of what to look, BVD, so if the bull's herd accredited free, most bulls need to be vaccinated to go to a bull sales. So even if your herd is accredited free, the bulls should have been vaccinated before they go to a sale. And that's to reduce the risk that they're then naive going into a commercial breeding herd and then could become infected themselves with BVD. So you should find that most bulls that are for sale are from a BVD accredited herd and have been vaccinated. Again, with IBR, it's important to understand the antibody status of that animal and whether the herd's accredited free. They're possibly not, but they might be vaccinating, and it's about understanding the risk level of those sellers. John touched a bit on the Johne's. So risk level 1, that is the low risk category. So that's where a farm has had 3 consecutive clear herd tests. And usually if they've got the pen card up, it will tell you the year that they received that accreditation. And it will also tell you the number of cattle that have been tested. So you can actually see if they're coming from quite a big herd or a smaller herd. Risk level 2 means that they've had 1 or 2 consecutive clear tests, but they've not yet achieved that third to make them risk level 1. So they're just slightly more risky than risk level 1. Risk level 3 is testing, the animals that are testing positive in the herd is not more than 3% of the herd, and risk level 4 is if there's more than 3% of the herd testing positive. And again, that's where it's really important to see the number of animals tested, because that percentage on a small herd, it doesn't take a lot to get 3% in a small herd. Whereas in a 200 cow herd, 3% is actually quite a number of animals. And risk level 5, as John said, was that they're carrying out the testing, but they're not adhering to some of the rules in order to get them to level 4. So it's just about being aware of those risks when you're looking at bulls. What I was going to say about if you were buying an older bull, perhaps privately, alongside all these other diseases we've talked about, it's important to consider Campylobacter because it can be an issue and can cause serious fertility and abortion issues in herds. So it's about discussing that before you buy that older or proven bull, is discussing that risk with your vet and looking at whether there's ways to mitigate that risk, or whether it's actually not worth the risk, and your vet should be able to help with that. Another thing that's happening quite a lot now is if you can buy your bulls privately and you can build up a relationship with the seller, and you know what their yoni status is, and you know that they follow good infection control procedures, it might be possible to purchase bulls. So even if they maybe are in a slightly higher risk category than a risk level 1, but if you know that status and you know that they carry out good infection control, and you only purchase animals from that are tested negative themselves, and they're from tested negative dams, that's another way of reducing that risk. And it's a good way to build up a bit of, working together with somebody else and having that honest conversation about herd statuses. So that's the kind of things to think about when you're buying a bull. Once we get into buying breeding females, I've kind of focused of breeding females. The pedigree end will be quite similar to the bulls in terms of the information that's available. But once you go into a commercial setting, there's a lot less information available on herd health statuses at commercial breeding sales compared to bull sales. So you tend to get in the catalogue, it'll tell you maybe a BVD status, and if they've been vaccinated, and perhaps if they're lepto vaccinated or IBR vaccinated. Very little will say anything about yoni status and such like. So it's about, I think there's more conversations need to be had with sellers if you are looking to purchase. And you can always inquire to the breeder to ask what their overall herd health status is. If they are a member of one of the health schemes, such as the Premium Cattle Health Scheme, there are links online where you can actually go and look at what their test results have been, or their most recent test results. So for Premium Cattle Health Scheme, there's a page where you can go to and you can look up members, and it'll tell you when their last test was, what the results were for the diseases they tested for. So that's a good way, if you had the catalogue in advance of the sale, you could check to see what the health status was of that herd and how that, whether that would suit you or not for what you're looking for. As I said before, BVD is quite a big risk, especially on in-calf females, bringing in in-calf cows or in-calf heifers. So Scott EID have a link where you can look up the BVD status of a holding, or if you've got an ear tag, you can look up the ear tag, and it will tell you the status, the BVD status of that herd. So that's quite useful again. So it's really about doing your homework before the sale. It's really difficult once you get to a breeding cattle sale to have time to find all that information out before you have to buy them. So it's just about spending time, if you have the information and know the animals that are available, to look that up and see what ones suit the health status that you're looking for. The other option is the same with the bulls, as if you go privately, is to have those open and frank discussions about herd health and what you're looking for, to try and reduce that risk coming into your own holding. And then finally, so post-purchase, ideally you would like to quarantine them for a minimum of 3 weeks. And what you want to have them is in a totally different shed to any of your existing herd, to minimize any nose-to-nose, no shared airspace or anything like that. It is possible to put them in a paddock and have, or in a small field away from other stock, but again, they would have to be double fenced away to remove any nose-to-nose risk. And ideally, you would keep them in that quarantine or isolation until you had done post-purchase testing of the diseases you wanted to look at, to make sure that even if they picked anything up at the market or something, it would then show up in a test before you let them mix with your own herd. And for Yonis, if they're over 2 years old, I mean, I'm sure Helen will go into this in more detail, but if they're over 2 years of age, you can do the blood testing and the dung sample. And the dung sample is just to make sure that they're not shedding the disease. And you just don't want that risk of them coming into your herd and doing that. The challenge with the Yonis testing is that it does take a bit of time to get those results back, and it's about being patient with that quarantine and that isolation to reduce that risk of that disease coming in. So yeah, that's very short and sweet from me. I'm sorry, but that's about it.
Thank you very much, Leslie. Some really good pointers there, and some good advice, especially around the quarantine, and some helpful guidance there on what to look for with sale catalogues and pen cards. Again, if anyone has any questions specifically for Leslie, please feel free to put them into the chat. I do have one question for you, Leslie. If a bull is from a herd classified as R5, but he is individually tested, does that reduce the risk?
Helen would probably answer this better than me, but I would say it wouldn't reduce the risk, because an isolated test result on its own doesn't give the picture of the whole herd. And it's, especially with Yonis, it's more of the whole herd because of the risk. So there's quite a long incubation period from infection, which tends to happen when it's a young animal, and then the clinical signs appearing in that animal later in life. And an individual test result, I don't think I'll give you a clear indication of the disease level within that herd, and that's the risk. I suppose you could do a dung sample alongside that blood sample that would then let you know if it was shedding the disease. But Helen is more qualified than me on that one. But I would be wary of an isolated standalone individual test if you don't know what the herd status is.
Do you want to add anything, Helen?
I think we'll get into that in a bit more
Okay.
detail. So I've got some graphics that will hopefully help, but I'd absolutely agree with Leslie that I think you're risking giving yourself a false sense of security by seeing negative blood results, negative fecal results, when we know that the herd of origin is R5. It's still a very, very risky move, and you have to weigh up whether you're prepared to take that risk. It might be that Yoni status is not the most important thing to you, and the breeding of that bull is more important, that you're happy to take the risk. But if you're selling breeding stock and an R1 status of your own is vital to you, then there's no way I would take that risk.
That's great. Thank you both. Is there less risk associated with buying a bull from an R3 herd if the herd is large in comparison to buying from a small herd? I think that goes back to what you were saying earlier, Leslie, about looking at the pen
number
cards.
of animals tested. Well, to get 3% in a herd of 10 cows is not that difficult. So you become a risk level 3 quite easily in a smaller herd. Or you require less animals to be positive to become a risk level 3 in that smaller herd. Does that make it more risky? the disease is present there, and I suppose it goes back to what Helen just said. It depends on how risk averse you are to that disease, how important that is, and I suppose your own risk. What risk level are you at yourself? What's the disease level like in your herd as to whether there's a big impact on you? And it's about having these discussions with your vet and understanding where's the best way to mitigate those risks.
To turn that on its head, you know, quite often people who are sat on an R3 status of their own, if they're looking to buy an animal and they see it's an animal from an R2 herd, they presume that that R2 status is better than their R3 status. You've got to remember, an R2 status could have had a fecal PCR result positive a year ago. You know, and there are, the majority of cattle on that farm could have been born at a time when infection was definitely known to be there. And so I'd really be looking for R1. R1 is 3 clear years, but the longer they've been R1, the better. The other way I look at it is the size of herd, but how contained is that herd? You know, you could have a small herd that actually purchases from multiple sources, and you could have a larger herd that's actually all homebred replacements. And I think the number of source animals is also a risk factor in there, and that's not that easy necessarily to find out. But it's worth asking the question. There's nothing to stop you asking a seller, you know, how many herd numbers they've got in their herd list.
Yeah, some good advice there again. Just a final question that's come in there. Again, it could be for either of you. Is it safe, or what's the risk from buying a bull from a herd whose risk level status has changed from the spring bull sales to the autumn bull sales? What would be the reasons behind this?
Helen, I'm going to pass that to you.
So I'm presuming that you're meaning that an animal has maybe gone from an R1 to an R3. Is that
I think I think that's what they mean, that the status has changed from one sale to the next.
Yeah, and it's a very dynamic thing, isn't it? You know, many herds will test just once a year, and so if there's a test coming up soon after a sale, then it's very likely that the status could change. And so if you've bought from an R1 herd that has since become R3, then that would suggest that there has been evidence of exposure in that herd since you have bought. It's the nature of the beast, you know, that can happen. And R1 is difficult to achieve. It's also difficult to maintain. And you just need to be aware of that. And it's probably no bad thing to be aware of that, because it might influence how you manage, you know, if that was a breeding cow, for example, it might alter your opinion as to whether you would retain her in the herd or whether you would retain her offspring in the herd. So it's worth keeping an eye on these purchased animals, what happens to their herd statuses as well, I would say. I hope that.
Thanks. Yeah, thanks, Helen. Hopefully that's answered the question. If not, please ask for more information, and as always, keep using the chat box with any other questions for Helen, Leslie or John throughout the evening. We will have a question and answer session again at the end, but at the moment we've no more questions sitting, and I think we should just move on and pass swiftly over to Helen, who's now going to cover Johne's disease and give us a bit more of an awareness of the disease.
Thanks,
Thank you, Helen.
You're seeing my screen in normal mode?
I am, yes. Yep.
Thanks very much. Okay, so thanks very much, Sarah, for well, you didn't really invite me, you know, I was second choice, but I won't take that too personally. So I'm more than happy to be speaking this evening, and thanks to those of you who are on the line to hear more about Johne's disease. As Sarah said, I'm one of the SRUC vets, so I spend a lot of time doing diagnostic work on clinically affected animals, so maybe blood samples, fecal samples coming in from animals that are sick, or maybe doing post-mortem examinations on animals that have died. But a big proportion of my time is also spent dealing with health scheme work, and that's a very different mindset to when you're looking at results from healthy animals versus looking at results from, from sick animals when you've got a good clinical suspicion of a disease being there. So today we'll talk about, this evening we'll talk about Johne's disease. And I guess I just want us to think about what is it, what is the disease, what causes it, and how is it spread. So John had told us that it's caused by a bacteria called Mycobacterium avium paratuberculosis. That's the only time I'll say that. I'll refer to it as MAP from now on. And MAP can give, in the most severe form, can result in this sort of clinical picture here, where we've got a very, very skinny cow that's got hosepipe diarrhea and is really losing protein. So it's a disease where the protein is lost out through the fecal material, out through the back end. And this fecal material can be very, very heavily infected with the MAP organism itself. And that means that if calves come in contact with that infected material, they could become infected. They won't show any signs of that disease initially because there's a very, very long incubation period, but in time, they might succumb to the disease themselves. So why does this bacteria result in a cow becoming very skinny and having diarrhea? Well, we had a cow in the postmortem room in Glasgow just in the last couple of weeks. I took the opportunity to borrow some photos from my colleague Alex. And what I've got a photo of here is the digestive tract of a cow that was suffering from Johne's disease. So I've taken away the stomachs, the rumen's not there, the true stomach, the abomasum's not there. All that is there is intestines. And I don't know if you've seen intestines before, but the wall of the intestine should really just be really quite thin and smooth. But even from the outside, before these intestines are cut into, I can see that areas of these intestines are much, much thicker than I would expect. And then when the intestines have been cut into, the cut surface of the inside surface of the intestine is terribly thickened. The mucosa, the cells of the intestine are very thickened, corrugated almost. And it means that the intestine can't function in the way it's meant to. So the intestines are where lots of the nutrients are absorbed. So that absorption of nutrients is impaired and protein just leaks out of the intestines as well. When we look at this at a microscopic level, I'm no expert histopathologist, but I wanted to show you this slide because all of these little pink dots here, this is at a very, very high magnification, but these are the MAP bacteria themselves. And so I want you to remember these pink dots because they're absolutely tiny. They cannot be seen by the naked eye at all. But that's the number of bacteria just in a very, very small section of intestine. Therefore, if you think of the amount of fecal material an infected cow can shed, there are millions of these MAP bacteria that can be spread onto your pasture that are on infected cows' teats if they've got fecal material on them as well. So we really need to be thinking about how we can break that sort of fecal oral transmission of MAP bacteria. There's been various studies to try to estimate the prevalence of Johne's disease, and I think the best thing that we can say is it's endemic in most countries, and we definitely believe it's endemic in the UK. Perhaps at a higher prevalence in the dairy herd, but the dairy herd are really putting in a lot of effort to try to identify infected animals and remove them from their herd as well. And a little look just before we came on tonight, just at the surveillance dashboard. So this is collated information from our labs and from labs in England and Wales. And this is public access. Anybody can go on and pull out this data. So I decided to look at the last 10 years for submissions from beef herds in Scotland to see what the #1 diagnosis was. And the #1 diagnosis was Johne's disease. So it's no wonder that I'm talking about Johne's disease, on a daily basis. So there were, almost 2,500 clinical cases of Johne's disease in cattle. So that's not animals that are infected, but not yet showing signs of disease. These are animals that are thin, that are scouring, and have had to be paid. You've got to pay to get them taken away. What I would say though is when I looked at the number of diagnoses, from 2013 to 2022, the number of diseases of clinical cases picked up by our lab, and testing is likely to be happening in other labs as well, and particularly in dairy herds. Milk testing will be done at other labs. The numbers of clinical cases is perhaps going down, but I think that's because there's much greater awareness of Johne's disease now, that people are investing in testing early to identify infected animals before they're showing some signs of clinical disease, so that they can remove them from the herd and still get some cull cow value from them. So it's obviously a disease of welfare concern, because an animal that's as skinny as that is definitely a welfare issue, but it's costing you money as well. This is a really interesting piece of work that showed that cows that were strongly antibody positive for Johne's disease produced calves with an average weaning weight of over 20 kilos less than test negative animals. And cows that were classed as being moderate to high shedders, so that's picking up evidence of MAP in the feces, the average weaning weight of those calves was 58.5 kilos less than the average of fecal negative animals. So, you start to see that not only are the loss of one individual animal that is sick and has to be taken from the farm, if your weaning weights are less as well, that's costing you money as well. The other thing to remember is that you've got these lower weaning weights, but feed costs will be the same. And in fact, feed costs might even be higher, because this disease will reduce feed conversion efficiency. Another study estimated the typical cost of Johne's disease in a suckler herd to be about £4,500. Every suckler herd is different though, so take these figures with a pinch of salt, but perhaps it would be a useful exercise for you to work with your vet if you're seeing clinical signs of Johne's disease, to try to put a figure on that yourself, to see what it is costing you, therefore what interventions might cost, and whether there would be a cost benefit analysis to do that. But my feeling is that there is more than likely a cost benefit analysis. It's likely to be of benefit to your herd to do that. So I think this is a concept that we sometimes struggle with. You can see the clinical cases, you can see the skinny cows that are scouring, but for every one of them, there will be more animals that test positive, either by probably on blood sample positive, but they might look perfectly well. For the number of animals that test positive, there are likely to be a much greater number of animals again that are actually infected. And so that's worth bearing in mind, that the testing that we will do will not pick up every infected animal. And I hope this chart will help to explain why that is. So most animals will first become infected with the MAP organism when they're very young, either just soon after calving, just soon after they're born, or perhaps when they're in the calving pen, or just in the first few months of life. That's when we believe most infections is acquired. And in most animals, cell-mediated immunity, so the calf's own immune system, will manage to keep the MAP organism under check and stop it from causing any disease at all. But as animals head towards maturity, and if they are going to succumb to clinical disease, but not all infected animals will succumb to clinical disease, if they're going to succumb to clinical disease, what will happen is that the calf's own immunity will dip. And often something stressful perhaps happens around that time. Maybe it's around about the point of calving, or perhaps an animal's been moved from one herd to another, or is under pressure or nutritional stress for another reason. And if the calves, or by this time the affected animal would be an adult animal, if the cow or the bull, if their own immune system is beginning to dip, then chances are they'll no longer be able to cope with the MAP, and the antibody levels might slowly begin to rise. These antibody levels might rise and they might fall again. They might rise and fall, but if they're going to succumb to clinical disease, chances are the antibody levels will go high and will stay high. The difficulty is, though, that these infected animals could shed the MAP organism at any time in their life, from when they're born to the day they die. We tend to expect them to shed more of it more often as they go towards being clinically affected, but they could shed it at any time. And some animals will shed more of it than others, and so they could be a source of contamination to cattle within your herd. So somebody had asked earlier, could I buy an animal from an R5 herd but just blood test it? What you could do is test it at this point in its life. So it's antibody negative, the animal's own immune system is managing to keep the MAP organism under check. It's not letting it do any damage. And the day you sample it, it might not be shedding because they will only shed intermittently. So I hope this lets you see why you could get apparently negative results in an animal that is actually infected. The difficulty with this disease as well is that there's no definitive answer as to the progression of this disease, what age they will definitely come down at, whether they will come down with it at all. And so the best thing we can do is to test regularly adult cattle over 2 to look for antibody positive animals and to make breeding decisions and decisions about replacements from these animals based on family lines testing as well. So testing is one way to control, but we need to do more than that. So when we're thinking about how can we control Johne's disease, what we're wanting to achieve is to reduce the harm that the MAP organism is causing. So we're probably not going to eliminate MAP altogether, but hopefully we can reduce the amount of it that's there and reduce the impact that it's having. So if there are herds that are apparently free, we want to keep them that way. If there are herds where infection is there, then we want to decrease the prevalence of infection. We want to decrease the number of animals that are infected. And we also probably want to have a way to be able to let other herds know what our status is, so that if we're wanting to source animals, we can make an evidence-based decision on what the best animals to source would be. So in order to do that, we either keep animals out, one option, or only buy from herds that have a degree of confidence about what their status is. In addition to that, though, we really need to think about how we can reduce, if infection is there, how we can reduce that spread. We want to identify high-risk animals so that we can remove them. And we want to be able to categorise our herds as well so that we can, if we're making progress, we can demonstrate that to our markets as well. So what factors are within our control? Well, John and Leslie have discussed that really well about what we can do to reduce our risk of bringing disease in when we're bringing in added animals. In addition to buying in added animals, so the other risks of entry that we need to consider would be slurry from other sources. So you wouldn't want to be using slurry from another farm and allowing that to be put onto your pasture, particularly if you're going to put young stock, because it's young stock that are most at risk. You wouldn't want them grazing slurry from an unknown source. Buying in colostrum might be a way that you could introduce MAP into your herd as well. So be aware of other ways that MAP could get in and discuss that one with your vet. If you do have Johne's disease, then we want to really think about how we can minimise the amount of onward spread that occurs within the herd. We want to think about how quickly we will detect disease if it's there. And we want to do everything we can to improve the resilience of your herd as well. So everything we can to improve that cell-mediated immunity so that they don't succumb to disease. And certainly cattle, say in small herds, are under very little pressure. MAP can be there and they never show seropositive animals because these cows could be living the life of Riley. They've got no competition. They've got all the feed space in the world. And very often these small herds never see clinical disease and they can be flabbergasted if they get a positive animal. But if you took that animal and put it into a more stressful environment, they might crash more quickly. I've got vaccination there in brackets. There is a vaccine available, but it's very tricky to use actually in this country because the vaccine itself can interfere with TB testing. So when I'm talking about the speed of spread, I think the main area that you want to focus on, that you want to think about, is really the calving area. Have you got just one cow to a calving pen, or do you have multiple cows in that area? How much fecal contamination is there? Do you also have sick cows in the calving area? How quickly can you remove a calf from an infected area? I've got pictures of two broad extremes here. And these sorts of pictures can be pretty emotive and could cause lots of discussion and lots of argument, and lots of people would have different opinions as to which you would rather calve in, or which environment you would rather work in. But the top picture is just showing what can be done. This is a dairy situation, so it's obviously completely different from the beef situation, but I just wanted to put it up to demonstrate herds that are really serious about Johne's control, they can snatch the calf out of that calving environment immediately to ensure that the newborn calf is not getting access to any infected fecal material. And this pen is spotless, isn't it? There's very little fecal contamination in that pen at all. And so from a Johne's disease control point of view, this is excellent. This is probably more typical of what our herds are dealing with. But I guess we should just try our best to be as objective about this sort of multi-pen, multi-cow calving pen arrangement as you possibly can, really thinking about what you can do to protect this newborn calf from getting access to infected fecal material. So identifying if you've got, if you know that you've got positive animals, but they were late in calf, so you couldn't remove them from the herd, really thinking about where you're going to calve them, could you calve them separately altogether, so that if there is going to be transmission, it's hopefully only to her own calf and not to 6, 7, 8 other calves that are in that same calving pen. So be as objective as you can be about your own setup, and work with your vet. Ask what can be done to improve that. Can you make tweaks? Can you make changes to reduce the amount of fecal contamination young calves are exposed to? Because although these cows might have tested negative for antibodies at their last herd test, we know that the test will not pick up all infected animals, so there is still a risk that there's Johne's in this environment. So what are our strategies if your herd is free? And we can't say free for sure, but if your herd is R1, keep it out by being really careful about your buying policies. If you don't know if you've got a problem, I would suggest it would be a good idea for you to find out. You might want to do that by becoming a member of a check scheme and testing annually. But another way to do it, if you just want to have a kind of look-see, some people will test cull cows as they leave the herd. And it's quite a wise thing to do, because abattoir studies have shown that many cows that leave the herd for another reason are actually Johne's positive as well. And so if you can identify that cow when she leaves her herd, that can help inform whether you would want to retain her offspring as replacements or not. If you do know that your herd's got Johne's disease, then it's really important, as well as testing and culling, that you really do your best to implement a really good hygiene program as well. But the aim is, if you can plan your culling, you can get money for cull cows, and so you can, the money that you save by not having to get a cow taken away by the knackers would probably pay for an awful lot of testing. We can reduce the level of clinical disease, and we want to reduce the new infections. So what we'd be wanting to do is effectively to push this iceberg to being a smaller one that's dipping below the surface. Some herds will be able to get this triangle very, very small indeed, but it would be very difficult for us to believe that iceberg could disappear altogether. But if we can, over time, certainly eliminate clinical cases and get our number of blood test positive animals down to a low level that it's only representing a small number of your culls, I think that would be considered to be a success. Ideally, we can get down to an R1 herd, in which case you can sell breeding stock at a premium as well. So this has been covered really nicely. If you're wanting to be part of the scheme, then it's important that all cattle over the age of 2 are tested annually. And level 1 is the best. That's suggesting 3 clear herd tests. Level 2, just 1 or 2 clear herd tests. Level 3 is less than 3% reactors. Level 4 is over 3% reactors. And level 5 might be that they're not adhering to any of or rather not adhering to all of the mandatory requirements. So, for example, they might be buying in a lot of animals and not doing the quarantine testing of purchased animals. And if that's the case, then they have to stay R5. Another reason for staying R5 might be if a herd chose to retain known positive animals rather than remove them from the herd. So just my last couple of slides, I won't go through them in detail, but it's just to let you know what these mandatory elements of the control programme are. And these are here because there's really good evidence that by following these, herds will make progress. So we must test all non-level 1 added animals prior to entering, prior to them joining herds. We really want to separate any known test positive calves from seronegative animals and remove reactors from the herd as soon as possible. We also want to not retain any calves at foot from reactors, And you need to have a health plan that you've worked through with your vet to identify risk factors for transmission and what you can do to minimise these. This point 3 talks about test positive cattle must be separated until follow-up testing is carried out. So by the rules of the scheme, if an animal has tested positive in agreement with the health scheme provider, it might be possible for you to do a fecal test. And if that fecal test is negative, then that might not count as a reactor towards your tally. Our advice would always be, if you get a blood positive animal that tests fecal negative, that's still a very risky animal. So we would strongly urge that that animal is removed from the herd regardless, because herds that retain these animals that are blood positive, fecal negative, these animals tend to test positive the following year and the following year again. And they might test negative on the feces for a year or so, but that's only a snapshot. As I said, they can shed the MAP organism intermittently, but eventually these animals tends to be shedding, and the truth is that they could be shedding all of that time and being a risk to your others. So that would always be our advice, even if you are doing confirmatory fecal testing, still to view those animals as very risky. The previous slide was the mandatory elements of the control programme. These are the advisory actions. And so it's really focusing a lot more on how to reduce the amount of fecal contamination your young calves are exposed to, and thinking about removing more calves from reactors, not retaining them as breeding animals. But all of this information is on our website, and it's also the CHECKS website and the CHECKS technical document. And your vet will be more than happy to talk through these control measures with you and give you really good practical advice about how to put these sorts of actions into practice on your own farm. So I hope that helps explain a little bit about the challenges of Johne's disease, but from a practical point of view, what we can do about it.
Fantastic. Thank you very much, Helen. There's been quite a few questions. We've got quite a flurry of questions, actually. I'll start with this one here. What age do cattle get infected? Is it only calves, or could a cow, say 6-year-old, become infected?
Yeah, so it's known that adult to adult transmission can occur, but we consider the most common time when cattle are infected is early on in life. But adult to adult transmission certainly is possible, and it's been documented in the research that can happen, in heavily contaminated herds.
Thank you. Is calving outside better to reduce the risk of transmission?
It might be. I guess it depends on how well you can keep your cows clean. But if the ground is not poached and the cows eat, then that might be a good way, and that would be preferable to a compact pen, straw pen where fecal material is building up. So that might be an option to try to minimise. We do need to remember though that the Johne's organism, the MAP organism, can survive in fields as well, though, so it's not a zero risk. There still could be MAP there, but if there's less fecal material accumulating outside than there is inside, then that might be better.
Okay, thank you. We've got another one here, and as always, keep using the chat and the Q&A box there if there is any other questions. Is Johne's as big a problem or an issue in sheep? And if so, should I be testing my flock for Johne's?
Yeah, it's a really good question. It's certainly a really common condition in sheep as well as cattle. There are different strains of Johne's disease, and some favour cattle and some favour sheep, but there is crossover, and so sheep can infect cattle and vice versa. The blood testing had suggested that the blood testing in cattle would pick up all infected animals, by the nature of the disease, and it's it's similar in sheep. And if you don't know if your flock has got Johne's disease or not, certainly blood testing is one option. Pooled fecal testing is another option, but I think a really good practical option would be if you've got cull ewes, ewes that are barren at scanning or at weaning time that are going to be away. that are, are lean, and there's not another obvious reason for them being lean. So, their feet are okay, their teeth are okay. These are really good animals to sacrifice. So you could maybe get a batch of, 3 or 4 to sacrifice to do post-mortem examinations on, and that would allow a really good assessment to be carried out to determine if Johne's disease is there. Also lets you see if OPA is there, or CLA, or myelofibrosis. So I think that's a really valuable way of screening a flock for Johne's disease.
Thanks, Helen. That's a really valuable piece of advice there, and not only just for picking up on Johne's disease, but for other diseases that may be underlying within your flock. Are some breeds more prone to showing clinical signs?
I wish I knew. I think some breeds have perhaps historically had more of a reputation for it than others, but that's maybe a reflection of the popular breeds in the country. There's a lot that we know a lot about Johne's disease, and we know how to control it well, but there's still a lot that's unknown. And what really interests me are what are the kind of resilience factors within animals that allow them to be infected, be in the same environment as others, but not succumb to clinical disease. And so I think genetics will play a part in that, but unfortunately we don't have the markers to know what they are yet. But that'll be brilliant when we get that. That will really help us potentially breed animals that are resilient, resistant almost to the MAP organism. Not completely, but I think that's hopefully for the future we might be able to have more information about that. But unfortunately, I don't have that information just now.
On a similar tone, this one is there a breed that is more associated with the disease than others?
I don't think there is. I think all breeds can have it. I guess some breed societies have perhaps been more proactive about trying to encourage their members to participate in health schemes to reduce the prevalence. So that's there's and put restrictions on selling breeding cattle unless they are participating in schemes. But no, I would say that all breeds could be affected.
Thank you. Helen, if a cow is blood positive for Johne's but not shedding, is its bull calf safe to buy? I presume they mean as a breeding bull.
I don't think that would be a wise buy. So it would suggest that the mother is infected, and I've talked mostly about infection being acquired from fecal material, but infection can also cross the placenta. So animals could be affected in utero. They could also be infected through the colostrum. And so I think it's very likely that bull calf will have been infected, and it won't test positive by any test for 3, 4, 5 years, but it could still be a risk to your herd because it could shed the organism at any time.
Thank you.
I suspect that's not the answer you wanted, but I think that's
again, if you want to comment further or discuss that further with Helen, please add some additional information into the Q&A box there, and we can certainly discuss that one further. But I think that was well answered there, Helen. And yeah. This one is more aimed at, I presume, for Leslie and John, and it's asking about Neospora in terms of how big a problem is it? Is it something we should worry about, and with having farm dogs in our fields and in our yards?
Anecdotally, just being out and about, talking to people, I think people do seem to think that Neospora is a wider problem than people have thought for a long time, and there might be a lot of herds that are infected without having any clinical signs of the disease. But that's my only real knowledge of it. I don't know too much. Helen, I know you've done some stuff on Neospora more recently.
I think Neospora might be one of my favourite diseases, actually. But I'll try and keep it brief. I guess one thing I would say is that we like to blame dogs for transmitting this disease, and dogs are really important in the life cycle of the disease. However, dogs can only become infected if they get access to infected placenta or to eat a dead calf. And so we can't really blame, folk from the town coming to walk through your fields. If those calves have never had access to infected placenta or calf to eat, then they cannot get infected. They cannot be the cause of the disease. And so actually the disease persists mostly down family lines from mother to calf, as John was describing. It's a more common cause of abortion in dairy herds than it is in beef herds. And possibly part of the reason to do with that is to do with immunity as well. That probably beef cattle's immune system is probably under less stress than high producing dairy cows are. And also having crossbreeds. I don't know how many pedigree guys are on the call, but in commercial cattle, having crossbreeds actually makes the placenta more functional, and so it provides a better barrier to the parasite getting from the cow to the calf. And so, yeah, that's perhaps part of the reason there is less abortions due to Neospora seen in beef herds compared to dairy herds. Saying that, there are some herds that we test, they see real problems down family lines, and that can be really heartbreaking because they might be really valuable genetics that they want to keep. But there's ways around that. We can do embryo transfer to salvage that valuable genetics, but it's certainly one has gone under the radar, but people are becoming more aware of, and you don't really know if you've got it unless you go looking for it.
And just another one here, Helen, and it's linked to just exactly what we've been talking about. Is infection just from dogs or foxes also? Presumably clearing all placentas from calving field is good practice.
Yes, so we can't blame foxes for transmitting Neospora. We can maybe blame foxes for other things, but that's not one of them. The only other animals that we could blame would be wolves and coyotes. I don't think we've in the wild, I don't think most of our herds are seeing them. So no, it's just really dogs. But I think you're right. I think it is good practice to clean up abortion products.
What are the implications for the herd if buying from a TB1 or TB2 herd?
I don't know, and it's whether you're on the TB, on the checks TB, it's the flip way round, isn't it, John? That
yeah. So that
is better, and 1 or 2 is a higher risk,
but it's all done by years, isn't it? So TB1 is 1 year free, TB2 is 2 years free.
Yeah. So I'm sorry, I need to get back to you to check on that. I don't deal with TB that often unless Leslie or John know, but I guess from a riskier herd, there's a possibility that you would need to do more testing on your herd once it's come in.
It would be tested prior to movement and would then retest on entering your herd. Anecdotally, people believe that animals from a TB1 or 2 area are slightly lower risk than a TB4 because you can go so long without being tested in a TB4. So there is the potential for it to exist without being identified, but they're TB1 and 2 for a reason. So I'm not sure where it stands on that, but people do bring in TB1 and 2s into TB4 areas and get on fine, and it's just about the testing, but you are opening yourself up to a TB risk that you wouldn't if you bought from TB4.
Okay. Yoni is being related to TB. Is there a danger badgers can spread? It's an interesting one.
Yeah, I'm not aware if any work has been done in badgers with Johne's disease. I know that rabbits, we can find MAP in rabbits. And so I wouldn't be surprised, but I don't remember reading literature about badgers being a major source there. But deer, sheep, rabbits, there are lots of other vectors for MAP.
I'm just cautious of time, but I think we'll manage another couple questions. Helen, in a small herd scenario, if there's animals that are intended to be kept for breeding, I presume they mean heifers, can they be tested for yonis if they're under the age of 2?
They can be, but probably knowing what their mothers and their grandmothers are is giving you more information than testing them under 2. If you got a positive, then you would not want to retain her, but the likelihood of you getting a positive at that young age is very, very low. So it's perhaps not a cost-effective way to test.
Okay. Do we have any other questions at all? There's none sitting. All the ones that were in the chat we've gone through. There's a few other ones came through to myself there on my phone, but all looks to have gone quiet. Just quickly, just to finish off, Leslie, do you want to just give us a sort of top tip for buying ahead of the spring breeding sales?
Yeah, it really is just about knowing your own herd status and understanding what risks you're willing to take, and having that discussion with your vet ahead of these sales, and really doing your homework in terms of what's available and the health status of those animals that are available and how they fit into your herd and your health plan, and what risks you and your vet have identified. So it's just about having a lot of planning ahead of buying these animals in.
Thank you. Helen, a take-home message with regards to Johne's disease?
Like, don't stick your head in the sand. If you don't know what your status is, speak to your vet and consider doing some testing to see where you're at.
Thank you. And John, what's the real benefit to being in a health scheme?
I would say just having a better understanding of what might be in your herd. As Leslie said, it's about knowing your own herd status. I'd say that's potentially a lot more valuable than what you could sell 1 or 2 animals for.
Great, thank you very much. I would just like to thank all of our speakers tonight. Thank you to John, thank you to Helen, thanks for Leslie, and also a big thank you to Malcolm, who's working there in the background, ensuring that all these small technical issues that we have don't cause too much problems and keeping things running smoothly. And also thank you to all of our attendees. I hope that you found this meeting useful, some really good practical advice and some good take-home messages there. And again, just thank you very much to everyone, and good night.